Hey guys, it's Tuesday and I'm Matt, and this week's topic is about surgeries that are available for trans guys. So there are a couple different surgeries I'm going to mention in this video. A couple of them I'll probably butcher the names to, and so yeah. Um, so the first surgery I'm going to talk about is top surgery. Um, and top surgery is basically, well, there's top surgery and there's bottom surgery. And top surgery is the chest removal, and bottom surgery is genital surgeries. So I'm going to focus on top surgeries. I think there's 4 different types of top surgeries available to the trans community that I'm aware of. The one that I see most commonly done, and the one that I am also interested in getting done myself, is called a double incision mastectomy. And basically what that is you get 2 large scars at the bottom of your chest. They cut you right here. And yeah, they remove the breast tissue. They also take the areola and the nipple, and when they sew you back up, you have the option of getting nipple grafts, which I believe most surgeons offer free of charge. So it's like a reconstructed nipple that they kind of place on. Or some guys choose to not get nipple grafts and get tattooed nipples, or just are okay with having no nipples on their chest. Double incision mastectomies are the most common option for guys with large chests. So, I mean, it gives you scars, really thick, 2 thick scars that run across your chest, and I really don't think that smaller chested guys who have other options of top surgery would invest in getting a bilateral mastectomy, because the scarring is kind of hefty. So yeah, that's double incision. So if you ever see a picture of a trans guy or a video with a trans guy in it with 2 huge scars, he had a double incision mastectomy. And then there's a peri-areolar mastectomy. I think I said that right. Peri-areolar. And basically, with that being said, it's for guys with smaller chests. So they recommend small cup sizes, and basically around the areola of the chest, or the breast, they create 2 circular incisions. So they just go right around the areola and make an incision, and then they remove the breast tissue, like kind of through liposuction. So the scarring is very minimal. The bad thing about this type of mastectomy is oftentimes breast tissue is left over. So after the surgery is done and healing process is done, a lot of trans guys decide to go back and get revision, so like liposuction, to take out the remaining breast tissue. But the good thing about this surgery is the scarring is extremely minimal, and you get to keep your actual nipple and areola. So that's like the plus of that. And then the next surgery available for also small-chested guys are, well, it's the keyhole mastectomy. And instead of like the peri-areolar, where they create a full circle around the areola to do like the removal of breast tissue, the keyhole only does like a half circle around each areola. And again, they do the same. They remove the breast tissue, and it's recommended for only small-chested guys, and same situation may occur where breast tissue is left over, so revisions with liposuction may also occur if a guy is not satisfied with his results. And then the last top surgery option that I'm actually not very familiar with, but I was very interested in learning because I could possibly get this option as opposed to double incision. The option is called the inverted T, or the T anchor. And basically, they kind of do the same thing as with a double incision. They cut you, but what they do is they leave your nipple and your areola, and they just reshape the nipple and areola. So, it's like, for example, with the double incision, you have big lines like that, and then like your fake nipples. But with the inverted T, you would have the lines of being cut and all your breast tissue being removed, and then like you would have your real nipples and areolas, and then there would be like a line connecting your nipple and areola to the double incision scars, so the big scars underneath. There would be like a vertical scarring connecting your nipple to those. But you do get to keep your nipple and your areola, so that's interesting, because nipple grafts aren't really attractive. They don't really look authentic. And inverted T or T-anchor incisions, they are recommended for guys with bigger, medium to bigger chests. So very interesting to learn about that one. So in regards to bottom surgeries, there's two different types. As for construction of like a penis for an FTM guy, there's a metoidioplasty. I know I butchered that. This usually just called a meta, but basically what they do is they already use the anatomy that you have. So, like for instance, if you're on testosterone, your clitoris becomes enlarged, and they use that already pre-existing organ and extend it and redirect your urethra opening so you can pee out of it, and that is your penis. And with that being said, a lot of people who get meta also do a scrotoplasty, which is the formation of a scrotum with your labia. So it creates like a scrotum underneath the penis. Another option for bottom surgery for trans guys would be a phalloplasty, which is a construction of a penis not using your already pre-existing organ. So they don't use your dick or anything. They like have to get a graft from a donor site on your body. So basically that means like somewhere with a lot of muscle, like right here on your arm or on your leg or on your chest. They take a chunk of skin and muscle and they construct a penis, and then they surgically put it on, and you have a penis. Personally, I'm not interested in getting bottom surgery, not with these two options. I'm not too interested in the meta nor the phalloplasty, so I think I'm going to pass on bottom surgery. But other types of surgeries that are important to the trans community, hysterectomies, so the removal of your uterus. That's important because, I mean, when you're on T, you have a uterus inside of you, and some trans guys still get their period, some guys don't, and if you don't, that just means you have a dying uterus inside of you, and that's disgusting. And if you do still get a period, I mean, what guy wants a period? So removal of a uterus is like totally expected. And then there's another type of surgery which I just learned about, a bilateral salpingo-oophorectomy, or a BMS, which is the removal of the ovaries and fallopian tubes. That's also pretty, I mean, I would think that's mandatory. Like I said though, I just learned about it, so I'm not sure if it's something that automatically happens with a histo or not, but I'm going to be interested in reading more about that. And then last but not least, before I hit my 10-minute mark on my video, popular surgeons in the U.S. for gender reassignment surgery that I'm aware of is Dr. Crane in San Francisco, California, and Dr. Garamoni in Florida. They're both commonly used amongst the trans community, and also in addition to that, a lot of people travel outside of the U.S. to get top surgery to countries like Thailand because it's a lot cheaper. Okay, that's all for this video. Thanks for watching, and I'll see you guys next week.